circulation in human body have two types. One is pulmonary circulation and other is systemic circulation. The greater circulation known as systemic circulation and smaller circulation, which is 9% of the total, is pulmonary circulation. This circulation happens from the heart. Firstly, blood goes into the pulmonary lungs, and after that, from aorta, it arises in the arteries and then back again from the veins into the heart. Look at this diagram. We have a heart. It's an aorta. It's a superior vena cava and inferior vena cava. From superior vena cava, blood goes into the lungs and back. This circulation known as pulmonary circulation. Which is 9% of the total. But from the muscles, blood arises into the aorta and goes into the arteries. When it goes into the arteries, blood into the arterioles, and from arterioles into the capillaries, and from capillaries into the venules, and from venules into the veins. In veins, it again into the heart. This is a mechanism of circulation. Capillaries, arteries here, and then arterioles, and then capillaries, venules, and veins, and back from the heart, from superior vena cava and from inferior vena cava. I hope you understand the mechanism of circulation. Inferior vena cava. In this circulation and in this circulations have similar blood. Don't be confused that I am making another blood vessel. So now concentration in arteries, which is 13%, and capillaries and arterioles have 7%. Venules and veins have 64% of the total. Look at this circulation. This circulation known as systemic circulation, which is 84% of the total. When we add 9 and 84, it is 93. It's 93%. But where is the 7% of circulation? Important to note that the remaining 7% in the heart. In the heart, 93 plus 7, 100% of the circulation. Now another point I want to explain that here is blood vessel. These blood vessels have cross-sectional area, which is inversely proportional to the velocity. How can we find the velocity? Velocity force per unit area. If velocity increase, cross-sectional area decrease. If cross-sectional area of blood vessel decrease, velocity increase. So now another point I want to explain you that what is the relationship of blood pressure, blood flow, and resistance. Look at this diagram. This diagram shows the blood circulation in blood vessel. Simply, blood flow, and we have blood resistance in the vessel. We have pressure between the two ends P1 and P2. And what is the relationship of these pressure, resistance, and blood flow? We find with the help of formula known as F delta P over R. If we want to find the pressure, we multiply the force and the resistance and total pressure in front of you. If we find the resistance, so how can we do? We divide force from pressure. So resistance we find with the help of this formula. Another point I want to explain you that in the blood vessel we have pressure. We have pressure. These pressure have two types. One is diastolic pressure and another is systolic pressure. Diastolic pressure, which is 80 millimeter of mercury. How can we find? We find with the help of millimeter of mercury. Blood pressure we find with the help of millimeter of mercury. Two types of blood circulation, two types of blood pressure, sorry. One is diastolic, another is systolic. Diastolic 80 millimeter of mercury and systolic 120 millimeter of mercury. Another point I want to explain you that in the blood circulation we have blood flow. These blood flow have different types, different method. One method known as semi-laminar flow, another which is turbulent flow. When circulation in the steady state at the center point of the blood vessel, known as semi-laminar flow. Look at this, the blood flow in the center, continuously in the center, and it in the straight line. Another which is turbulent flow, it is directly proportional to the velocity. Look at this vessel. When velocity increased, blood flow increased. Due to the velocity, it is an irregular form, which is an irregular form. This is known as turbulent flow. So I hope you understand this mechanism. Thank you so much.